Hello and welcome. I'm Saad Dino, pharmacist and co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug in Newton. I would like to welcome everyone back to our show, A Healthier You, where we discuss ways for you and your family to live a healthier lifestyle. Today, we are talking with Dr. James Greenblatt about ADHD, also known as Attention Deficit Hyperactivity Disorder. Dr. Greenblatt is a psychiatrist and the chief medical officer at Walden Behavioral Care in Waltham, as well as an assistant clinical professor at Tufts School of Medicine and Dartmouth College School of Medicine. In addition, Dr. Greenblatt is the author of several books, including Finally Focused, the Breakthrough Natural Treatment Plan for ADHD. Thank you for being here, Dr. Greenblatt. It's an honor to have you here. I'm thrilled to have you, as I said, and today we want to educate our viewers about ADHD, which affects 1 in 10 children in the U.S. and nearly 15% of all boys in the U.S. Could you please start by telling us exactly what is ADHD?
ADHD is a psychiatric disorder most commonly diagnosed in childhood, but we also see it in adults.
Okay.
There's lots of confusion of what the diagnosis is. We've been naming it and renaming it since the 1900s,
Okay.
based on the current knowledge. But I believe in the last 10 or 15 years, we do understand that ADHD is a biological, kind of genetically driven disorder that affects attention span, impulse control, and overactivity. So it's difficulty inhibiting behavior as well as focus, sustained focus.
So it's diagnosed in children and adults?
The diagnosis is primarily in children.
Okay.
Oftentimes it's missed, and an adult might realize it for the first time in college or when they're with someone in a relationship, or more often than not when they can't kind of work up to their potential at work or in life and realize there's something that might be going on, oftentimes ADHD.
Thank you so much for that, doctor. You have written several books about eating disorders and depression. May I ask what made you write about ADHD?
Well, when I came out of training almost 30 years ago, ADHD as a child psychiatrist was a big part of the practice.
Okay.
And at the time, medications were limited. It has some effect, but there were side effects. So I started exploring nutrition and alternative treatments.
Interesting. Okay.
And they were very effective and helpful, but I didn't have all the research to support what we were hoping to do with our patients and families. Over the past 30 years, there's academic, scientific research supporting the relationship between nutrition and ADHD. So I really felt I had to write that book for both patients, families, and my colleagues to demonstrate that there is nutritional relationships between some of the symptoms of ADHD.
So not only are you treating patients with medications, but there's a natural aspect, supplementation aspects to it as well.
Yeah, the term that I describe myself as an integrative psychiatrist.
Awesome.
So I teach physicians how to write the correct medications for disorders, but also how to integrate nutrition and healthy lifestyle choices, which can be very helpful for the treatment of ADHD.
Excellent. Thank you so much. I'm sure there's some viewers who are parents watching the show right now. Doctor, if they feel concerned about their child, they maybe feel concerned that the kid has ADHD, where do they start? How do they get the child diagnosed or looked at, or what procedures should they take to ensure that the right diagnosis is at hand?
I think it's really important that they see a mental health professional, could be a psychologist or a social worker that's really trained to see children.
Okay.
And trained with some experience with ADHD. The pediatricians often write the prescriptions. They don't have the time to do a real comprehensive assessment. So it should be a combination of a mental health professional with a pediatric visit to make sure there's no other medical problems, from lead to thyroid, are all medical conditions that could cause ADHD. So I think a mental health professional with a pediatric visit to really assess if ADHD is a problem.
And can you just discuss a little bit the assessments that are taken to diagnose somebody with ADHD?
Sure. The simple line is there's no test for ADHD.
Interesting.
We can't do a blood test,
Yep.
and we can't have a paper checklist. So, and part of the reason I think is really important is that the environment really affects the symptoms. So there are kids who have symptoms of ADHD, they're performing poorly in school, with friends, in a group, but one-on-one with a psychologist, they might be very focused and do well. So it's hard to make the diagnosis based on a single evaluation, but we do have decent testing, neuropsychological testing, computerized testing, to give us some guide as to attention span and impulse control. So it's putting together a lot of information based on psychology as well as the medical.
Okay. Do kids outgrow ADHD eventually? In your opinion?
Well, many kids take the symptoms of ADHD, which is high energy and passion and creativity, and find the right niche in life and do great.
Okay.
There are other kids that really struggle. They struggle through high school, through college, and we know adults do have ADHD, but adults with ADHD have a higher percentage of divorce, financial problems, job dissatisfaction, even car accidents. So there's a subset, little less than half of kids with ADHD that have symptoms into adulthood.
Okay. And what causes those symptoms in the adults? Is it just being mistreated? Meaning, they're misdiagnosed, I should say, not mistreated.
Misdiagnosed or undertreated.
Okay.
Or not treated at all.
Okay. Okay. So, you're a psychiatrist by trade. So do you see ADHD being diagnosed along other, if I may call them diseases, such as, or disorders, such as autism spectrum or sensory processing disorders?
Sure.
So they collaborate.
Yeah, ADHD is can be seen with anxiety disorders, depression. In adolescents or adults with substance abuse problems is not uncommon. And in the younger kids, the autism spectrum disorders, oftentimes they can struggle with very profound attentional problems.
Okay. And, a lot of people probably associate ADHD with a medication that's been around for a long time, such as methylphenidate or the brand name Ritalin. But that's not the only medication used for the disorder, if I may call it that. Can you talk about different medications commonly used to treat ADHD and the potential side effects and benefits of such medications?
Sure.
Because, as a pharmacist, a lot of parents have concerns, when they get that prescription, first prescription, what do I need to look at? What are the symptoms I need to watch, and how is this going to help my child, and so on and so forth?
Yeah, the list of medications are growing as they're all kind of based on the same formulas, so either an amphetamine-based or methylphenidate. But there's probably 10, 15 different preparations. And I think what's really important for parents is that it's important to start at the lowest possible dose.
I agree.
And titrate up slowly. Because there's no way that your doctor can predict the correct dose. In the old days of my training, we used to think it was based on weight, but that's not accurate. I have football players that take, less than a 6-year-old. So per milligram, it really is just trial and error, but the lowest possible dose and titrating up. And I believe that's probably the most common concern among both my colleagues and parents, is that they either overshoot, they just give a high dose, and that becomes a side effect, or too low a dose and they don't get better and they stop the medicine.
So what are the more side effects you see that parents report back to you or patients report back to you with these types of medications?
The most common side effects are decreased appetite, insomnia if the medication is taken too late in the day, and the other side effects could be anything from agitation, anxiety, picking and nail biting is not uncommon.
Okay. And so you hit on, and I think when I hear, as a pharmacist again, doctor, I hear the eating part of it, and you hit on nutrition early in our discussion. So how do you teach or reassure parents with kids that are having issues with eating when it comes to ADHD?
Yeah, really important question, because there are parents that have gotten a medicine from a pediatrician and don't follow up for 6 months, and their child has lost a lot of weight and has a weight problem. Some of them I've seen with an eating disorder, but some are just now underweight and malnourished. So we have to be really careful. The good news about having so many options for medications If someone has severe appetite suppression on medicine A, we would just switch to medicine B or C. So there's usually some mild decreased appetite, but some medicines for that individual can be much better.
Now, we discussed on the amphetamines and the methylphenidates, but there are other options as well with new classes of drugs that have come out in the recent years.
Correct.
Right?
Most of, I think, the effective results, 70, 80% efficacy, are on these kind of stimulant-based, so either the amphetamines or the methylphenidate or variations of those drugs.
Okay.
There's another class of medications, Strattera,
Sure.
that is just not consistently as effective. For a small number, they can be.
Yeah.
But it's really the amphetamine group that most effective, but also the most potential for side effects.
And you hit on natural treatments for ADHD, and that's what your wonderful new book is on. Obviously, diet and exercise are important in the treatment parameters for ADHD. Can you discuss that a little bit, doctor, please?
Sure. I mean, we've been writing about and using natural therapies with medication, for almost 30 years now. And most of the time we can eliminate those side effects we just described, the irritability, the agitation, the sleep, by a mineral supplement you can get at a health food store or pharmacy called magnesium.
Okay.
So magnesium is by far the most common nutritional deficiency we see with kids with ADHD, and it can be incredibly helpful in minimizing the side effects to medications.
Now, magnesium is an important mineral in our body in many different enzyme channels and such. It's a very important mineral.
Sure.
So you also don't want to take too much of it, because there could be a side effect of, example, is diarrhea.
Correct.
So how do we, is there a certain salt form that you prescribe, or is there, a certain product that you like to utilize when it comes to magnesium, and how much do you
Sure.
give?
Well, it kind of depends on weight in the child,
Fine.
but I think
Yep.
certainly for adolescents or adults, trying to get 400 milligrams per day divided.
Okay.
And rather than recommending a supplement, I kind of do the opposite of what not to take. And I think if we're treating ADHD, we don't want magnesium oxide,
Yep.
because that becomes the laxative.
Sure.
So magnesium citrate or glycinate are two magnesium preparations that can be helpful.
So typically you would, if it's dosed, if somebody needs 400 milligrams, you would give 200 milligrams twice a day.
Correct.
Is the dose morning and night?
Yes.
Okay, thank you so much. Any other supplementations you like to utilize?
Well, I mean, there's many,
Of
and
course.
part of our book
Yeah.
is kind of helping parents kind of identify which supplements for their child, because everyone's different. Magnesium happens to be the first chapter because everyone, I'm exaggerating, but the vast majority of kids that we're seeing are deficient based on our testing. So that's the easy recommendation. The other one that's often common and where there's a lot of academic research is zinc deficiency.
Okay.
So elevations of a mineral called copper,
Yep.
creating a zinc deficiency, is a very common imbalance in ADHD.
So obviously there's a lot of correlation between increased copper in the body and because it eats away at zinc, correct?
Correct.
So that's what you're trying to tell our viewers, is that there's a zinc. Also, zinc comes in different salts. Is there a different one is there one that you particularly like?
There's not one over the years that I think either in our practice or the research has shown to be better than any of the others.
Awesome. Thank you so much. I think we hit on this question earlier, Doctor, but I just want to elaborate on it a little bit. So the specific question is, for those children who need medication, what strategies do you use to reduce the side effects or to reduce the amount of the drug that's needed?
Okay. The medication question is often difficult for parents. Oftentimes I have one parent who says, please, and the other parent, my child is not taking a pill. And so first we need to kind of get the families on the same page.
Sure.
Second, the discussion is we're just going to try the medicine. It doesn't mean your child's going to take it for the rest of their lives.
Okay.
We're going to see if it can offer them some benefit. And the most important thing I can say is, as we discussed, starting off at a low dose,
Yep.
because it can't predict, and then titrating up until we get some improvement. The other important point that I stress with parents is the child or the adolescent, they're not going to feel different because it's not a feeling disorder. It's not like depression where you feel sad, you take a pill, I might feel better.
Yeah.
The kids might not notice any difference, but the parents, your teachers might say homework is better, behavior is better, relationships with friends are better, but the child's not going to feel different.
That's an interesting statement. So, can you elaborate on that a little bit?
Sure.
What's the reason, if I may ask, if it's known?
Yeah, well, it's just that the disorder, ADHD, is based on how one behaves,
Yep.
how one does something. And oftentimes the kids don't really see that. They see the effects of it. Maybe I hit the kid in class, or I spoke out too much. So he'll recognize, oh, I got stars all week.
Yeah.
And that's really important. So it's important that we give them kind of the visuals or the checklist to say, you did a great job. And so they can see the difference, because they might not feel the difference.
No, you have tons of experience, doctor, with ADHD. What's the youngest child, if I may ask, that you diagnosed with ADHD?
Well, we certainly begin to see symptoms from 3 to 6.
Okay.
I am a believer of not medicating the young children.
Okay.
So for me, I'd like to utilize nutritional approaches until at least first grade before I recommend medications.
Okay. So first grade is kind of your cutoff for.
For me, the Academy of Pediatrics now recommends medicine in 4 years of age if needed.
Okay.
In my experience looking at the nutritional integrative therapies, oftentimes we can make a huge dent in those early behaviors with the kinds of things we outlined in the book.
Now, just going back to magnesium for 1 second. If somebody, if you notice somebody has a magnesium deficiency and you supplement them with magnesium, does that do anything to their doses of medication that they need, in your opinion?
Not to the dosages, but it clearly will minimize the side effects.
Got it. Thank you. So there's long-acting medications, as we discussed, the methylphenidate or the amphetamines, and they're short-acting. And the question is, sometimes people get them confused, and when can they be used and not used? Obviously, we always recommend when we counseling patients, is try not to give it past 4 or 5 o'clock in the afternoon. Otherwise, the insomnia or having hard time going to sleep is going to be an issue. How do you decide which medication to give at what intervals?
Well, my preference now is always the longer acting medications.
Okay.
I think that if either a parent or the child has this mentality that I really can't do this work or project without taking a pill, it's a dynamic that I try to avoid.
Sure.
So I much prefer taking one pill in the morning.
Okay.
That's going to last throughout the school day. As the preparations get better, we have longer acting preparations that usually can get them through homework.
Okay.
Occasionally, for kids that are really struggling, we would give an afternoon short-acting dose, around 3 o'clock.
These are Schedule 2 medications, Dr. Greenblatt, and they could be a potential addiction. Can you discuss that just a little bit for our audience?
Sure.
What as a psychiatrist, your concerns with such medications?
Well, I think we all should be concerned about these medications on college campuses. I mean, it really is a very significant drug problem. So everyone that I've spoken to, college kids, and I've spoken to many, they all know who has amphetamines, and during test time they line up at the other kids' dorms. Some kids sell the medications, most kids just give it away. And so they're using it to kind of study for finals. So I'm very reluctant now to give medications to college kids because I think it's both abused and misused.
Okay.
For my adolescents, my younger kids, my adults who take it responsibly, I'm not as worried. And a lot of parents are worried about my kids are going to get addicted. And the research is actually quite clear, is treating ADHD actually prevents substance abuse problems.
Interesting. So going back to the college kids real quick, and as I have 2 college kids right now in college and such, so maybe a lockbox for those that definitely need it, and and such are offered at the pharmacy, so they could do that, and there's other mechanisms that they could talk to their pediatrician or pharmacist about ways of locking those things up to protect the medication for that specific child. So I know you're concerned, because I hear about it as well, and we're dealing with it with the opioid crisis that's going on statewide and nationally. It's kind of sad, and we all have to do our part to ensure that these medications only be taken by those individuals that need it.
Right.
So I appreciate your efforts in that, Dr. Greenblatt. And you hit on this question. So the youngest that you would prescribe any medication is 6 years old. In your practice?
In my practice, it's now, as I use more nutritional supplements, it's usually 6 to 7 years old.
Thank you so much. We discussed a lot of children. Can we focus a little more on adults? How often do you see adults with ADHD?
Over the years, it's certainly increasing. 15 years ago, we didn't really think ADHD was an adult disorder, that you just outgrow it.
Okay.
And you might outgrow the hyperactivity, so you're not running around the kitchen table or the classroom or your job.
Yeah.
But it becomes this internal sense of hyperactivity or restlessness inside. Okay. So it does translate, and this is good research to, as we discussed, higher incidence of job dissatisfaction, traffic accidents, divorces, and financial problems. So significant impairments in many aspects of their life, relationship problems.
Okay.
So if we can aggressively treat it, be it natural means or medications, that many adults are very appreciative and can really work up to their potential, because it had nothing to do with intelligence or opportunities for success.
Okay.
There's a lot of literature, some of our best athletes and some of our best CEOs of major companies have publicly talked about having ADHD, because being able to act quickly, making decisions, being impulsive, taking risks are kind of traits of successful individuals throughout history.
Great. Just back one question about medications. Are there any concerns with medications in young, these are high school or young kids, in playing sports? Because, there's some concern that sometimes, they make you hyper and palpitations and such. Do you have any concerns with that?
I think we're always asking the child and the pediatrician how they're doing.
Okay.
Most kids don't really need the medication during sports times.
Okay.
Particularly a good athlete, a high school athlete, maybe the young child at soccer is staring off in space and might need it. So oftentimes we would not use medications, because we know exercise actually helps attention and focus.
Sure. And
many of these kids aren't needing the medicine during these sports events.
And the question that I get asked, and I just remembered, do I need to give the child the medicine during the weekends? What's your thoughts on that?
Well, like most questions, I'm going to say it depends.
Of course.
And there are kids who are doing very well socially, and at home it's just academic performance, and they might not need it on weekends. Okay. There are other kids that really struggle with these core symptoms, and 7 days a week makes more sense.
Okay, thank you so much. And finally, doctor, are there any misconceptions about ADHD that you want to tell our parents and our audience
I
that
think
you face in your practice?
Sure. I mean, I think in my world now, where I bridge the kind of nutrition community and the medication community, people kind of dig their heels into, I never want to prescribe medicine for my child, or somebody says medicine's the only answer. And my message, reason why we wrote the book, is that an integrative treatment approach is by far the best. Okay. Parent training, behavior, nutrition, lifestyle, and medications for those that need it.
I said finally, but I have one more question. What is the difference between ADD and ADHD?
Well, as we went through this 100 years of changing the name, there's a period where we had those two different names. So just those with attention problems and those with hyperactivity problems. So now we've kind of lumped it all into one name. Okay. So we don't actually use that anymore. So everyone has ADHD. The question is, some might have more inattentive problems, and some might be more hyperactive problems.
Thank you so much, Dr. Greenblatt. As the school year is starting to wind down, and some parents may be wondering why their children were struggling to make expected progress over the year, they may want to find out more about ADHD, which is why we are so pleased, Dr. Greenblatt, that you were able to join us today to discuss an important topic. Thank you again, Dr. Greenblatt, for being here and taking the time to speak with us about this important topic, as I said. And thank you all for tuning in to A Healthier You. For health-related topics and more information, you could find us on Facebook and Twitter by searching for the keywords Acton Pharmacy, Keys Drug, or West Concord Pharmacy. I'm Saad Dino, and I look forward to seeing you around town. Be well.